So I was talking to a couple of women as of most recent, and the discussion was, I wish I would have worked with you when I was going through menopause, but now I'm done. So, there really isn't any benefit. And I say, oh, okay, I get it. Like, as far as like your vasomotor symptoms, like all of those hormonal fluctuations have calmed down. And I'm like, that's wonderful. But then I asked them a question and I'm like, okay, but what about, are you on vaginal estrogen therapy? And they look at me with a blank look. The moral of the story is that once we are either perimenopausal or post, when we lose the estrogen in our vaginal tissues, that never gets better. And it's not going to get better on its own. So there are treatments for it, but a lot of women are they're just too afraid to talk about this. No one really brings it up. It becomes an issue in their life with their spouse as far as intimacy, and they end up having recurrent urinary tract infections, bladder leakage, pain, decreased libido. All of this exists and it's not comfortable to talk about. And a lot of women go to see their providers and it's not brought up. These conversations aren't being had. I have patients that are coming to me at this point who are having pellets placed. The pellets are being placed with testosterone, the goal being that their libido will increase. Well, when you check all of their levels, they're perfectly fine, but yet their libido isn't back and they don't understand why. So once you fix it physiologically with vaginal estrogen, guess what? The blood vessels come back, the sensation returns, the urinary tract infections go down, and the patient's much happier. There isn't one woman on this planet who would not benefit from vaginal estrogen therapy. It is approved for every single woman. If you have had a history of a blood clot and you were not a candidate for systemic estrogen therapy, it's okay, because we have data that shows that vaginal estrogen therapy is not systemically absorbed and it's safe for every single woman. There's different ways that it comes. It can either be in a cream, there's a tablet, there's a ring, there's multiple different ways of delivery. So whatever works out best for you, I'm totally cool with, and we try to make that plan together. But you can be on vaginal estrogen therapy until the day that you leave this lovely planet. So there's no time constraints. There's no medical reasons that you can't be on it. And once we do that, you tend to feel better. Sex doesn't hurt. You have less urinary tract infections and quality of life improves. So I would love to work with you. I know this is a sensitive subject, but it's that important to me. So I wanted to be sure to bring it out to your attention. Have a great day.